across day to day in our gynecology, which is about the polycystic ovarian syndrome. Polycystic ovarian syndrome is affecting about 30% of the women today, and it is on the rise because of the lifestyle changes that have come about and because of the unhealthy diet that people indulge into. Polycystic ovaries means it is a component which is seen on an ultrasound, which shows that the ovaries are quite bulky, which can result in irregular menstruation or sometimes even absence of menstruation, which makes a patient a little obese, and that can lead to fertility problems, which means to say that the patient might find some difficulty which is planning for a pregnancy. Women with PCO can have some cosmetic concerns as well, because you have seen these patients tend to have excessive body hair growth as well as the facial hair, and they can have increased amount of oil secretion which can result into pimples or acne, and they can also have excess of melanin secretion which can result in a condition called acanthosis nigricans, which means that there is dark pigmentation around the inner aspect of the thigh, inner aspect of the axilla and around their neck. Now these conditions mainly are because of a hormone which is produced by these polycystic ovaries, which are basically the androgens. Androgens are present in every woman, but it is usually in a suppressed state. But when they have a polycystic ovaries, these androgens are activated. The stimulation of excess of androgen producing cells, which are called as theca cells, which are present around the ovaries, are responsible for increased production of androgens, which result in these male hormone features. Next, we are going to look about how these polycystic ovaries are going to have a relation with that of irregular menstruation or absence of menstruation. We always know that the average menstrual cycle is about 28 days duration, and it can go about plus or minus 7. That means 21 is also considered as normal and 35 is considered as normal. Anything beyond 35 or anything lesser than 21 is considered as an abnormal menstrual cycle. Now this average days of 28 days of menstrual cycle, there is something called as ovulation which takes place around the 14th day. Now this ovulation is not fixed in every individual. It could happen on the 14th day, it could happen on the 21st or even the 27th day. So what happens in polycystic ovaries is, we know that the follicles that are recruited, they don't grow to the optimal size where they can ovulate, and the ovulation is actually absent. When there is an absence of ovulation, no egg is produced, and there is nothing to signal the endometrium in order to increase or to reduce the growth of the endometrium or to have a withdrawal bleeding. So because there is absence of ovulation, the endometrium tends to grow, and the cycle, which is actually within the 28-day span, gets extended to about 45 or even 60 days of menstruation. Since these PCO patients tend to get obese, they can have long-term health consequences like that of developing hypertension, diabetes and dyslipidemia. And the hormones which are most commonly affected along with PCO is thyroid hormones and the prolactin hormones. These patients can even present you with hypothyroidism or hyperprolactinemia, and until we tackle these hormonal abnormalities, PCO cannot be tackled. Since polycystic ovarian syndrome is related to excess of estrogen production, this can result in development of fibroids in the uterus. They could also have endometrial hyperplasia. They could also land up having ovarian cysts, and they can also present with some kind of lumps in the breast, which are called as fibroadenosis of the breast. All this is because of the increased amount of estrogen that is produced during when the patient is having polycystic ovarian syndrome.